Hello, it's Rhian here from Not Just Backs, and I'm really delighted to announce that Ed Webb is returning to practice next week, so on Wednesday. So hi, welcome back, Ed.
Thank you, it's good to be back.
So some of you will know Ed because, when did you start with me, Ed? How many years ago now?
It was about 2.5 years ago, so just at the start of 2018.
That's right, yes. And Ed started at Exeter Street as well as when we were at Salisbury Medical Practice. That was right, wasn't it? You were there for a bit.
Yes, I was, yes.
So it's really lovely to have Ed back. So Ed, tell us a little bit about yourself and why you sort of got into osteopathy to start off with.
Well, I was a mature student when I started studying. I was about 26, so quite a while back now. And I originally wanted to study a science-related degree because I've always had an interest in health and disease. So the more I looked into it, as I was looking through university courses and things like that, I was going to go down the biomedical science route, but I've always had an affinity for holistic health and natural health, and how that corresponds and relates to your overall health, basically. So osteopathy kind of came up in the search, and I've always had an interest in the human body and the biomechanics and how that relates to health as well. So I just found it would be the perfect degree for me to study and pursue a career in, as opposed to biomedical science, because I think I'm more of a people person in that respect. So I started my journey in the British School of Osteopathy at the time.
Mm-hmm. Now called the University College of Osteopathy.
Which is now the University College of Osteopathy, yes. And started my master's degree there. When did I start? It was 2014. It was a tough degree, I'm not going to lie, but it was very rewarding. And I learned actually a lot about biomedical science on that degree anyway. So, we spent a good 3 years studying in that kind of field, as well as osteopathy on top of that. So it was a kind of win-win for me, really. Yeah. Yes,
no, you forget how tortuous a degree it is, really. There's a lot of contact hours, isn't there?
There's a lot of contact hours, yeah. There was a lot of exams to complete, a lot of coursework, a lot of studying, a lot of knowledge that you had to absorb in that space of time. Plus, when you got further on into the course, you had to start working as an osteopath in the teaching clinic to try and apply some of those, or all of those skills that you've learned.
Yeah, that's right.
Very full on.
Yeah, I mean, they make you a safe osteopath so you can try and pick up other diseases it's not a musculoskeletal problem, and then refer on to the GP or wherever it needs to go. And so I suppose it's why it's so heavily biomedical to start.
Yes. Yeah. Yes, because a lot of it is, like you said, it's making sure that we are safe to treat, because we are primary care practitioners. So we're in the front line. People come to see us with an issue, and we have to sift through and triage them to make sure that they are safe to treat, or whether we need to refer them on to another healthcare professional for further investigation or further treatment.
Yeah, that's right. So, talking about treatment, what sort of things do you like treating? Have you got any interests or specialities or?
Well, I say, I'm kind of an all-rounder really, but I do have a special interest probably in the lower back region. Maybe a bit biased towards that because it's what I've seen the most.
Yeah.
But, having treated, all body areas, I say the lower back is probably my favourite area, if you will. Mainly because, it's I find it quite important in aspect to health and disease, and the kind of what we call the biopsychosocial aspect of pain. So what I mean by that is how your mind and body relate together. And a lot of the time what I see with lower back pain is people that have issues with stress or emotional issues, and how that corresponds to pain, and trying to convey that to people as well, and teach people that the mind and the body are quite connected to each other as well. So, you know, the lower back is quite a significant area. It's probably what we're known for the most as osteopaths as well, even though, as the name suggests of the business, we are not just backs.
Exactly.
But the lower back connects obviously the pelvis, the legs, the hips, the mid-back. It's quite an important junctional area to treat.
That's right.
Yeah.
So let's just talk a little bit more about the biosocial aspect, because so what sort of stress are we talking about here? Just work stress, or what? Deeper stress, maybe?
I think both, but a lot of it is deeper stress. So, you know, when we talk about emotional stress, we're talking anything from, you know, unresolved psychological issues, even resolved psychological issues. They can lay their mark in the body for many years. We hold tension in our body, sometimes unconsciously. In fact, most of the time unconsciously. A lot of patients that see me I'm not aware of the tension that they hold in their body, and that tension is a manifestation of a lot of the time psychological issues, deep psychological issues. So a lot of my work is trying to work through them, not, you know, on a psychological level, but referring them on if they need further help from a profession that's, you know, suited towards that. However, a lot of my treatment does kind of intertwine with that as well, so they do get a psychological benefit out of my treatment as well.
Yes. Yeah, I think, you know, we do a lot of talking, don't we, in practice? So
Exactly, yeah.
You know, it's that getting issues out and talking about it.
Yes.
Quite helpful. But as you say, a lot of the time people don't even realise that they are tight or they're holding tension, because a lot of the tension, I find it comes from our childhood, and particularly under 10, and how we've responded to things back then as well.
Yes.
That goes
definitely.
really way back, and it's such a fascinating area.
It is.
And I suppose the hardest thing is to make people aware that they have this tension, because a lot of the time they might not believe us. I don't know if you found that.
I do. I think, but I think there's sowing the seed kind of goes a long way, you know. So even just kind of bringing it into their consciousness is very powerful, I think. And then it's up to them whether they decide they want to do something about that or not. But me, as the osteopath, is trying to get them out of their immediate pain, and that's kind of the first kind of barrier to work through, and I think the rest kind of flows after that. Yeah,
and I think it's that first presentation of somebody who's got pain, and then they might come back, you know, I don't know, 6 months later or a year later, and they've got the same issue again, and then it's like, well, let's look a little bit deeper at why this is reoccurring, and that's normally when we start sort of digging a little bit deeper about what's going on. I don't know if you've done that. And then people are a bit more receptive to finding out actually what is going on with my body.
That's it. Yeah, and it takes time, like with everything, you know. Recovering from trauma is, you know, a multifaceted area to try and work through. It's complicated, but it's for me, it's very rewarding to kind of help these kind of patients recover.
Yes. Absolutely. I'm totally with you there. I do a lot of that for myself, as you know. Yes. So I'm going to be a little bit personal, Ed, because I want to just highlight the age you are. I mean, it's not uncommon anymore to have braces in your 30s. But But can you tell us why you've got your braces? Because I know it's sort of slightly related to osteopathy and backs and things.
Yeah, so yes, I'm 34 now, so it's a little bit, well, some would say it may be a little bit late to have braces because they're usually on teenagers, but you know, I've had issues with my teeth all my life, and it's been quite well hidden because I keep my mouth closed a lot of the time, but I have a condition called retrognathia, which is where my mandible, which is the bottom jaw, doesn't meet my top jaw. So it never developed properly. So that means I kind of look a little bit like Bart Simpson. And it's subsequently caused a huge kind of chain reaction with the adaptation of my teeth, because as we as osteopaths know, the body is great at adapting. So my teeth have had to adapt to meet my bottom teeth. So they've gone inwards, they're inclined, and they're rotated as a result and all skewed up, basically. So they're very overcrowded, and it's over my life, it's, you know, when I was in my teens and even in my 20s, it never really posed that much of a problem. However, as you know, I started to get a little bit older, I started getting problems with my neck. The top of my neck, right at the base of my skull, and right at the bottom of my neck and my mid back as well. Now, what this system is called in your jaw and your neck, it's called the stomatognathic system. And this system is really closely connected. So it's the mechanics of it is, if you have, you know, an issue in one area, like your jaw or your teeth, it's going to affect what's going on in the neck. And for me, it's, you know, I've got issues in my neck, my jaw, and my teeth as well. So I think something had to be done about it, because if you just leave these kind of structural issues, especially issues like this, it's a long-standing issue that I was born with. It will eventually deteriorate. It won't get any better. So I actually went to, I didn't realise that I could get it for free on the NHS because I just wanted my teeth straightened. I didn't know the full complexity of it at the time. So I went to a private orthodontist and they said, look, you know, you can get this for free on the NHS because it's deemed as a medical issue. So I went down the process and I got the braces. Yeah, so I've had them for 2 years now.
Right. So how long is the process is it for you then? How much more do you think you need to do?
Well, this is the golden question, which I never really truly get the answer for, and it depends. Yeah. They don't really know. Orthodontics is very unpredictable, and it's very much a kind of treat issues as they arise. So as the teeth start to straighten, another issue with another tooth might arise. So they have to make adjustments every time I go there. And I think as a ballpark figure, they probably said 3 years. Right. So I've probably got another year in braces, but I will have to have surgery on my jaw as well. Oh, gosh. And then after that, I'll probably wear the braces for another 3 months and then they're off. And then my teeth will be aligned. And hopefully my neck issues will, you know, disappear.
Yeah, I know. Yeah, because I mean, we treat a lot of people through their brace work.
Yeah.
To correct and just get the body to mold around the new changes that are happening in the jaw. Because, you know, as you say, you know, if you're like you with your jaw back, you know, it really you know, sits on the brain stem as well. So you can have
it does,
you know, foggy issues with the brain, tiredness, and all that sort of thing as well. And
it's really affects, because you know you've got all of, like you said, the brain stem. It's supplying all of the body. You've got all the nerves coming down from the spinal cord, and if you think about it, if the jaw pushes back, on the opposite side you've got the vertebrae. if that's pushing back that vertebrae. So, you know, in regards to treating patients, we'd always be looking at treating the upper neck and try and release some of the restrictions that might be occurring, probably will be occurring at that region, to help the process.
Yeah. And my patients who've had it end up with fingers in their mouths and all sorts of things with the cranial work to release all the
yes, all of that as well, and at the front of the neck as well. It's really important. We've got lots of small intrinsic muscles that supply the front part of the neck that need to be treated off. Further afield as well, you know, it can affect the mid-back, the thoracic spine. I've got a spine here. It affects this area as well. You know, you can have issues going all the way down. So yeah, it can really affect a wide range of areas, and breathing as well, the diaphragm. So yeah, it's really all connected.
It's fascinating. And I think like with babies with tongue ties and lip ties, you know, it all starts at that age, you know, and how your tongue around your mouth and develops the mouth parts, and then breastfeeding and the sucking and you know, for your bottle fed, etc. That all starts from that really young age. So it's completely fascinating area. So it's a big topic which we could talk on forever about.
Yes.
But I think that's great. Thank you very much, Ed, for joining me today, and
you're welcome.
And welcome back to the practice, and lots of people will see you over the next few weeks. Oh yes, and I forgot to say that you're doing Saturdays is your main day.
Saturdays, yes.
And then in the next few weeks you'll be doing some extra cover as well while I'm.
I will be, yes.
Yeah, so it's lovely. Thank you for joining us.
Thank you. Hope to see you all soon.
Yeah. Bye.
Bye.